All right, the next section in lesson 5 is the metabolic syndrome. You may have heard this in other classes, but we're kind of bringing together a lot of the terms and symptoms and disease risks that we've talked about in previously. So the metabolic syndrome is characterized by a group of metabolic risk factors in one person. People with the metabolic syndrome are at increased risk of all sorts of metabolic diseases, coronary heart disease, plaque buildup, stroke, type 2 diabetes. It affects over 50 million Americans and counting. And the dominant underlying risk factor for this syndrome appears to be abdominal obesity, the visceral fat, a large waist circumference, and insulin resistance, which we talked about before. So it's why the metabolic syndrome is also called the insulin resistance syndrome. Back in the day, it used to be called syndrome X, but now it's changed to metabolic syndrome. Here are the characteristics of the metabolic syndrome. You need to have 3 of the following 5 risk factors to be considered to have the metabolic syndrome. Abdominal obesity in men greater than 40 inches, women greater than 35 inches. Triglycerides that are equal to or above 150. HDLs that are less than 140 in men and less than 50 in women. Blood pressure, which is greater than or equal to 130 over 85, and then the fasting glucose greater than or equal to 100 milligrams per deciliter. Again, you do need to know these characteristics on the exam. You'll be given a case study, a scenario, and you'll need to identify if the person has the metabolic syndrome or not. All right, now we're going to watch a video that gives an overview of the metabolic syndrome, and a little bit of discussion, and then we'll move on and talk a little bit more about the risk factors. All right, so this is a video over the metabolic syndrome.
It's characterized by a group of conditions that greatly increase a person's chance of developing heart disease, stroke, and diabetes. The definition of this syndrome differs among experts. However, they all agree aggressive measures should be taken to treat each disorder associated with it.
Now, metabolic syndrome is getting quite a bit of attention, both in the professional literature as well as in the lay media in recent past. Metabolic syndrome is a cluster of abnormalities that tend to occur in the same people. And by definition, the metabolic syndrome means that you have 3 of the following 5 abnormalities.
The first abnormality is high blood pressure or hypertension. A blood pressure greater than or equal to 130 over 85 millimeters of mercury meets the criteria for hypertension.
The next one is an abnormal level of blood glucose. This may or may not be associated with diabetes, depending on how high the blood sugar is. But this would include a blood sugar that in the fasting state is greater than 100 milligrams per deciliter. And a lot of people do have what we call prediabetes, so not a high enough level to be called diabetic, but high enough that it's no longer considered normal or optimal. And that's an area between 100 and 125. So those are the first 2. The next one is a tendency to carry one's weight around the waist. So it's a waist measurement where a person tends to be kind of apple-shaped rather than pear-shaped. For women, it's a waist measurement greater than 35 inches, and for a man, a waist measurement greater than 40 inches. And so where we carry our weight tends to be probably even more important than what our overall body weight is. The last 2 characteristics are those associated with the cholesterol profile. And the first one is a triglyceride level greater than 150. And the second one is an HDL or a good cholesterol level that's less than 40 in men or less than 50 in women. So we have 5 characteristics: hypertension, abnormal blood glucose, an increased tendency to carry the weight around the waist, a high triglyceride, and a low HDL. And any 3 of those 5 qualifies one for metabolic syndrome.
All right, so that was a video over the metabolic syndrome to give you another look at what are the risk factors for the metabolic syndrome. Now we're going to go through several slides that just kind of illustrate why the metabolic syndrome is bad for somebody, increased disease risk. You don't need to memorize these slides, but they're just more of a of a importance about why the metabolic syndrome is so bad for somebody's health. So here's again metabolic syndrome, the prevalence. As one gets older, the prevalence of metabolic syndrome increases. It averages around 24 to 25% of the population. It also affects different sex and race, ethnicities. As it varies, but it's around anywhere from 20 to 35% in both men and also women. Here you have the impact on mortality. This is with the metabolic syndrome. The red is without, or excuse me, the yellow is without the metabolic syndrome, and the red is with the metabolic syndrome. The all-cause mortality, in other words, the increase in chance of death. You can see it's quite large with the metabolic syndrome versus not having them. Same thing with the cardiovascular mortality is much greater with the metabolic syndrome than without. Same thing here where you have without the metabolic syndrome, and then the red is with the metabolic syndrome. And looking at coronary heart disease, myocardial infarction, and stroke are all increased compared to with the metabolic syndrome compared without the metabolic syndrome. Here's looking at a 10-year history. They looked at individuals, they tested them, and then they followed them 10 years past and found the individuals with a metabolic syndrome had about 3.5 times the risk of mortality than those that did not have the metabolic syndrome. So this indicates that people who have developed the metabolic syndrome and left untreated can have long-term increased mortality risk than those individuals who do not. What are some treatments? Well, lifestyle therapies are the first line of intervention. Weight loss to achieve desirable weight of a BMI less than 25. Increasing physical activity of at least 30 minutes, moderate intensity most days of the week. Make sure you eat a healthy diet is also important, including fruits and vegetables, reduced saturated fat, trans fat, and cholesterol. Can all be ways to treat or help treat or at least prevent potentially developing the metabolic syndrome. Here's a video that talks about the importance of the exercise and how that can improve the metabolic syndrome. All right, so this is a video that illustrates the importance of exercise and how it affects the metabolic syndrome.
Brenda Fulcher used to be like many Americans, seldom exercising and leading a relatively sedentary life.
Just working and going home and eating and sitting down and watching television and not thinking about exercise, really. Just, not a part of your life.
But from 1999 to 2002, Brenda, along with 226 other previously sedentary, overweight, middle-aged adults, enrolled in a Duke study that randomly assigned them to either 6 months of their normal routine, that is, general inactivity, or one of 3 8-month exercise training groups. One group did moderate intensity physical activity on an exercise bike, treadmill, or elliptical machine for a short time each week. Another group worked out at higher intensity for that same amount of time per week. And a fourth group did vigorous activity for a longer period of time each week.
We found that individuals that were at risk of developing diabetes improved that risk or had a lower risk of developing diabetes over the course of the exercise program. But even in the exercise group that was only doing moderate level exercise, as well as the vigorous groups.
Researchers looked at 5 risk factors: increased waist circumference, lower HDL or good cholesterol, higher triglycerides or bad fats in the blood, increased fasting blood sugar, and increased blood pressure, all of which increase the risk of developing diabetes. The study showed these risk factors were greatly improved in the study groups that stayed active.
We're talking about maybe 30 minutes of a walk in a neighborhood 6 days a week as a tremendous benefit to your health.
Once her participation in the study ended, Brenda kept working out most days of the week, continuing to reap the health benefits that regular exercise offers. At the Duke University Medical Center, I'm Mike Garrison.
So that video shows the importance of the exercise and reducing the metabolic syndrome, which is very important for our long-term health. So this just kind of summarizes the metabolic syndrome, predicts the development of both diabetes and coronary heart disease. Insulin resistance and obesity characterize most individuals with the metabolic syndrome. Initial therapy for the metabolic syndrome should consist of proper diet, increase in physical activity. Some conventional cardiovascular risk factors such as lipids and blood pressure should be treated in individuals with metabolic syndrome. And finally, there really is no consensus that exists on whether insulin sensitizers should be used in non-diabetic individuals with metabolic syndrome, but at the very least, what is important is focusing on diet and exercise to help reduce the effects of the metabolic syndrome. All right, so this concludes the section on the metabolic syndrome. Continue to review this, making sure you have a good understanding of the 5 characteristics of the metabolic syndrome, because you will need to know them as you're given a case study on the exam and to identify an individual who has the metabolic syndrome. Also, this concludes the lesson for all of lesson 5. So make sure that you review and prepare for the exam, looking at Blackboard, the practices, the videos, and the handouts and the readings. Okay.